Let's move to the other big story tonight. Are private hospitals profiteering at the expense of patients? The National Pharma Pricing Authority has analyzed bills from 4 hospitals in the National Capital Region and has put out a long report. The report claims that hospitals indulged in unethical profiteering and profit margins on certain drugs and medical devices were exorbitant. Let's go across to Ekta Batra now. She joins us with the details. Ekta, what is the NPPA saying?
Well, yes, an important and long report which in fact came out from the NPPA, where they've analyzed 4 bills from hospitals in the Delhi NCR region on the basic premise of overcharging. The names of the hospitals and the cases, however, have not been disclosed. So what the regulators, for example, have found is that doctors' hospitals prefer to prescribe branded drugs which are not under price control. The drugs which are not under price control, in fact, have been growing at a double the rate that than those drugs which are, in fact, under price control by the NPPA at this point in time. Separately, there have been exorbitant profit margins as well as unethical profiteering, which has been charged when it comes to basic things such as syringes as well as catheters by the hospital to the patients. And overall, the patient's expenditure was inflated by around 3 to 4 times in cases, and patients were not given a choice to procure drugs and devices outside the hospitals. The hospitals, in fact, benefited the most, according to the NPPA, vis-a-vis drugs as well as device manufacturers. Overall, they have mentioned that policy intervention is required to address high growth in drugs which are not under price control, as well as requests from some manufacturers in terms of devices have come through for rationalizing the margins that we've seen.
Ekta, many thanks. As Ekta was pointing out in its report, the Pharma Pricing Authority illustrates with examples how certain drugs and medical devices were sold as what they claim is inflated prices. For example, let's take a disposable syringe. The NPPA says hospitals buy the syringe for just 3 rupees but sell them at 35 rupees. The maximum retail price at a chemist is also 35 rupees. So where is the profiteering? The NPPA report says, and I quote, "Industry, in order to get bulk supply orders, is in a way forced to print higher MRPs as per requirement. This is a clear case of market distortion where manufacturers, after accounting for their profit, print inflated MRPs to meet the demands of a distorted trade channel without getting any benefit from this artificial inflation." So the regulator clearly hints at a nexus between manufacturers and hospitals, but I must reiterate, the report has only analyzed 4 hospital bills in the National Capital Region. To discuss this further, we're now joined by Aggarwal, the former president of the Indian Medical Association, and Shailaja Chanda, the former Secretary for Health for the Delhi government. Mr. Aggarwal, let me start by asking you, the NPPA has put out a fairly scathing report where they are accusing hospitals of putting pressure on manufacturers to inflate the MRP. So they're selling at MRP, they're buying for much lower than MRP because they're buying in bulk for the manufacturers. And they're also, in a sense, saying that, look, the manufacturers are actually not benefiting from the higher MRP. It's the hospitals who are profiteering. How do you respond to that?
See, I am going to read out 2 things. One is Medical Council of India Ethics Regulation 6.3, which says it is not unethical for a physician to prescribe or supply drugs, remedies or appliances as long as there is no exploitation of the patient. Therefore, it is a responsibility of the doctor to see to it there is no exploitation of whatever he prescribes to. There is a Samira Kohli
Who decides what is exploitation, sir?
Which talks about...
Mr. Aggarwal, who decides what is exploitation? Because the NPPA very clearly seems to be saying in its report, the NPPA is saying in its report that hospitals are guilty of profiteering. They're guilty of... Yes, sir, go ahead.
I am saying the same thing. Just listen to me. I am saying there is another Supreme Court judgment which says cost has to be reasonable. You have to, which is reasonable, the cost has to be reasonable without exploitation. Therefore, if there is a profiteering, it is an exploitation and not warranted and it is not acceptable. Therefore, as far as drugs are concerned, government has to come forward and come out with a one drug, one company, one policy. and all the essential items and disposable. The syringe is an essential item. Needle is an essential item. IV set is an essential item. They all should be price capped, and that price cap has to be reasonable. I am with you. I am saying whatever is happening is wrong. Delhi government is trying to come out with this capping shortly, and we have asked all the hospitals to do a self-regulation. This types of a profiteering is neither allowed by Medical Council of India nor allowed by the Samira Kohli Supreme Court judgment.
Okay, so you're saying that the government should in fact bring in price caps when it comes to essential disposables like syringes, etc. And the NPPA report has brought up the issue of catheters as well. But Shailija Chandra, the NPPA here saying that, look, we need policy intervention. The government must act because what they claim is a collusion between hospitals and manufacturers, where they claim it's the hospital that's benefiting and this distorted trade channel continues to be perpetuated. You know, what do you believe is the need of the hour today?
The need of the hour, and I've been saying it for a very long time, is that you need a medical regulator, whether it is a medical tribunal or whether it is some other kind of a hat that a person wears or a body wears. You do need to have regulation. At this moment, healthcare is being treated as an industry on one side. On the other side, it is being treated perfectly as something which is like a market wholesaler and then the retailer, and you just go to the wholesaler in Chandni Chowk and get something at 1/4 of the price and then sell it in Connaught Place or some other fancy place for 4 times the amount. That is exploitation, but that is totally permissible under market realities when it comes to everything except health. When it comes to things like syringes, devices, things like that, you cannot take the public for a ride. This has to be monitored, this has to be regulated, and there has to be rules and guidelines as to what you cannot do. It's not enough to have something said by MCI. What has MCI done about it? What have the state medical councils done about it? What have the health departments of the states done? I don't think it's enough just to quote the rule book. The doctors are definitely doing this for profit. And it is because it is being treated as an industry. The minute it is treated as an industry, they will do all the things. There is no audit of this kind being carried out. The audit is of a completely different nature. You need auditors who will go into this. I remember getting a complaint that a person had been billed for 64 packets of gloves. He said, my wife did not even require gloves to be used on her. Maybe on one day in the operation, 64 packets couldn't have been used. And it did turn out that it was some sort of a typographical error. How can this happen? I think this is something serious. A regulator is needed. There are many ways of doing it. Other countries have them. I don't see why we are allowing ourselves to be taken for a ride.
Right. Yes. Mr. Aggarwal, you know, respond to Shailija Chandra that what has the MCI done, and don't quote me the rule book because, you know, what we're telling you about is the situation that exists on the ground. Now, the government brought in a bill to try and reform the Medical Council of India. That seems to have been put in the cold storage or at least on the back burner for now. Why won't you allow the reform to take place?
I think when I was a part of Medical Council of India Ethics Committee, we were the one who took actions against some of the hospitals. And the hospitals went to High Court and took a stay that hospitals are not covered under Medical Council of India. Now, at Maharashtra Medical Council has approached the government to allow hospitals to be examined by the Maharashtra Medical Council unless the hospitals comes under the preview of Medical Council of India. Even in the National Medical Commission, they are not. So question is that the Indian Medical Council Act has to be amended, that all the hospitals also needs to be covered under the disciplinary action of Medical Council of India. I agree with you. If the hospitals are not, today there is a High Court judgment that says hospitals are not under Medical Council of India Code of Ethics. And that's the reason their ethics are different. They have a business ethics and medical profession has a medical ethics.
Okay, Shailija Chandra, I'll end by asking you, you know, as I said, that bill was meant to be taken up, then there was this strike that was called, it's been pushed on the back burner for now. But do you believe, you know, price cap is the answer even when it comes to not just drugs, but even disposables?
Yes, I do feel so. I think as far as drugs are concerned, it would not be really in the interest of patients to be forced to take only something that is listed. If there is research and there is a feeling that a person can benefit from the latest drug, I don't think that kind of a cap should be put on drugs. But certainly on devices and on consumables, these gloves and syringes, needles, things which are used on a very wide scale, there ought to be a cap, and there ought to be also a system by which you cannot, force a person to buy it from the hospital. If I want to go to the market to buy it at my own risk, I should be allowed to do that. This is very unfair that you go to the hospital pharmacy and you're forced to pay the MRP.
No, you're absolutely right, and that is something that the NPPA report also points to. But this is, as we mentioned, a report that has analyzed bills put forward by 4 hospitals in the National Capital Region. What the government intends to do by way of policy action is the question that we hope to have answered over the next few weeks. Shailaja Chandra and KK Aggarwal, always a pleasure. Appreciate you joining us here on CNBC TV 18. Coming up next.